Main rules of application IIX. We have defined the main rules of the application of DD water as follows. The dose applied should be defined in harmony with the patient's condition. The aim is to ensure the minimal effective dose and to maintain the decrease in the concentration as long as possible. Based on our experiences, tumor regression occurs gradually in weeks, months, or years. We suppose that the reason for this is that the cell is sensitive to D-depletion in a given phase of its cycle only. When the decrease in the concentration occurs, it is only cells at a given point of the cell cycle that necrose. Cells, however, which are not in a phase sensitive to D-depletion, get adapted to the slowly decreasing D concentration. If, by dosage, we lengthen the reducing process of deconcentration as required, we can achieve that in the body there will be a decrease in deconcentration even when cells, which have adapted to a lower deconcentration, enter the given phase of cell division. Suddenly administered great doses may produce quick results at the beginning of the treatment, but later, if further decreases of deconcentration are not possible, cells in a resistant phase, having adapted to DD water medium, will be able to proliferate. The quick decrease of deconcentration may be justified with sensitive tumor types, or where tumor mass is not significant, 1 to cm in diameter. But when tumor mass is considerable, for example colon tumor with a multiple expansion in the liver, according to our present knowledge, a lower initial dose and its slow increase may bring better results. It is not advised to suspend DD water consumption while the tumor is detectable in the body. DD water consumption exerts a selective stress on cells, to which tumorous cells are more sensitive than healthy ones. During the application of DD water, in the beginning of the treatment, we decrease deconcentration, and later we ensure a constant deconcentration in the patient's body, on a level significantly lower than natural concentration. The cessation of this selective stress, that is the suspension of DD water consumption, results in an increasing deconcentration, which, according to our experiences so far, may lead to tumor growth. The process, however, seems to be reversible, which means that the resumed consumption of DD water may again stop tumor growth. But then the result achieved at the first application can no longer be reached. This observation justifies that the patient should suspend DD water consumption in medically reasonable cases and after relevant control examinations only. DD water cure should be continued even after complete remission, for a minimum of 6 to 10 months. The duration of post-treatment may vary according to the type of the tumor, for example with tumors of the ovaries, breast, glioblastoma, astrocytoma, etc. A longer post-treatment may be needed. Our general experience is that the patient should feel threatened only if he arbitrarily stops treatment before time. Following from the character of the disease, the most difficult thing to decide is when the patient can be considered as healed. In this respect, it is of special significance that the treatment of the first patient began on the 30th of October 1992, and since that time we have followed several hundred patients for several years. The first patient began consuming DD water with inoperable prostate cancer, urination problems, and a slightly elevated PSA value. His urination problem stopped within 2 weeks. PSA value also decreased, and after a month the tumor was no longer palpable. The patient had been consuming DD water for a year, and has been free of symptoms and complaints ever since. During the past years, we could successfully suspend the treatment with several patients without relapse. But unfortunately, it also happened that a patient had a relapse within months following the suspension of DD water. Before suspending or finishing the DD water cure, the dose should be decreased gradually. The sudden cessation of DD water consumption results in the quick increase in deconcentration in the body. In the case of patients who had stopped DD water consumption before time, a relatively quick deterioration was observed. This may be explained by the fact that the increase of D concentration creates favorable conditions for tumor cells to proliferate. To patients who stop DD water consumption in a controlled manner, or to those with whom we suspend consumption because they have for a longer time been in remission, a lengthy and slow decrease of the dose is recommended. We presume that deconcentration, thus slowly nearing the original, cannot be used by eventually still present tumor cells to such an extent as if original deconcentration returns suddenly. We consider it to be of special importance that DD water should be withdrawn gradually. If the patient had, for a longer time, been consuming DD water of 30 to 50 ppm D content, be with patients in remission. After a break of 2 to 3 months, we recommend to resume the cure even if the patient has no complaints at all. In such cases, the renewed 4 to 6 months consumption of DD water may be followed by a longer break of 4 to 6 months, followed by a new cure lasting for 2 to 3 months. The repeated consumption of DD water is justified by the fact that we cannot state that after a symptom-free period of 1 or 2 years, we have really succeeded in selecting all initial tumors. The repeated consumption of DD water inhibits cell division and may destroy possibly existent cell groups, which, in time, may result in macroscopically demonstrable tumors. We have several experiences when no tumor could be verified by imaging, but the change in tumor marker values demonstrated the effect of DD water while they decrease after the consumption of DD water. It is not recommended to decrease the daily dose during treatment, only to increase it or keep it at a constant level. The grounds for this is that it should never happen even with daily fluctuation that deconcentration temporarily increases in the body. Experience tells us that patients who consume their doses during the day in even amounts, by 2 to 3 dl, show better results than those who consume the total amount on 1 or 2 occasions. It is advisable to ensure the daily fluid intake in the form of DD water. The optimal decrease of deconcentration may be reached if the patient, within rational limits, consumes DD water only. This does not exclude the preparation of soup or other meals with normal water, but drinking water should be ensured from DD water. The establishment of the daily dose must, thus, be harmonized with the fluid needs of the patient. By the increase of concentration resulting from normal water and food consumption should be balanced by the consumption of small volumes, 0.51 of 25 parts per million DD water. Experience gained in the past years has unanimously verified that the increase of concentration resulting from untimely suspension of DD water consumption favors tumor cell growth. The tumor is able to grow again. And this fact is verifiable with diagnostic instruments within weeks. We suppose that it is also favorable for tumor cells if, after food intake, selective stress decreases for a while, because the normal deuterium content of the food temporarily increases the deconcentration in the body. To counterbalance this, we recommend the consumption 0.51 dl undiluted 25 parts per million DD water after meals. The doctor should check changes and follow the effect of DD water at first 6 to 7 days, then 18 to 21 days after beginning the DD water cure, later once a month. In the first few days, usually no significant changes occur, but as we are dealing with the application of a new preparation, the close follow-up of the patient is justified. 18 to 21 days after beginning the DD water cure, the patient usually becomes spiritless and somnolent. Further monthly control is justified by the continuous and timely correction of the dose of DD water. Guide and tables to dosage. Dosage schemes, in the case of detectable tumors, are based on direct observation. With patients in remission as well as the healthy population, we also have direct experience, but our recommended dosage has been extrapolated using the daughter cancer patients in the first place. We suppose that if within a time unit cancer patients show significant regression, then with patients in remission, initial tumors below the detectable level also become necrotic on the effect of DD water. We have divided the population into two main groups. The guide to preventive dosage for the healthy population group H is dealt with in Chapter I of Book 1. In the chapter written for doctors, we have summed up our recommendations for patients diagnosed with cancer and already treated Group C. This group is further divided Group CR and CD. To Group CR belong patients who had previously been diagnosed with tumor but presently no tumor can be verified, total remission are, while Group T are those in whom the tumor D is still present. Both Groups CR and CD are further subdivided. Concentration values in the protocol should be ensured for the patient either directly by administering DD water of the given concentration, or by mixing water of a low D content with natural water according to certain rates Table 11.7, from water of a low D content. A preparation of a concentration lower than 15 ppm but higher than the original can be produced. With concentration values, the mean value is given. A deviation of 5 ppm is within the limit of tolerance. It should be noted that in protocols the lowest D concentration is 25 ppm. It is possible to produce water of a lower D content, but presently it is not available. Group C cancer patients in remission. Group C are patients who had already been diagnosed with a malignant tumor of some kind but at present are free of symptoms. Constitute this group. These patients get therapy, surgery, chemotherapy, and radiation therapy, and thanks to this, they are free of tumors. The differentiation of two subgroups is justified. CRI, the patient subsequent to the first treatment or series of treatments had remission, and treatment was finished more than 1 year ago. There has been no relapse since the setup of the diagnosis and treatment. The patient is free of symptoms and complaints. The latest control examinations are not older than 3 to 4 months and are negative. Within this group, further subgroups could be made according to whether the chances are greater for healing or relapse. Since this is almost impossible to decide in the case of a given patient, the dosage protocol was elaborated to avoid occurrence of the worst event, that is relapse. The application of this might seem over-insured in the case of a patient with good prospects, but it also increases the chances for healing. For patients in the CRI group, we advise the consumption of DD water according to Table 11.14. It is recommended to repeat the protocol after a break of 1 to 2 months. Following this, H protocol should be repeated yearly for a period of 3 to 4 years. Table H14 dosage guide for patients belonging to Group CRI. CRI, the patient is tumor-free and post-treatment has been finished within 1 year or is still going on. This includes patients in remission who underwent at least one relapse but due to renewed treatment, remission was achieved again. In this group, despite remission, relapse may be expected, as there had been, for example, distant metastases. The size of the primary tumor had been more than 1 cm. Of the tumor type is characterized by the appearance of metastases, etc. For the treatment of patients belonging to type CRI, we recommend consumption of DD water according to Dotter in Table 11.15. It is advisable to repeat the cure after a break of 2 to 3 months at least once. This should be followed by Protocol CRI, taking the shorter recommended duration, for example 5 weeks, 7 weeks, 10 weeks, etc. And Protocol H yearly, for a period of 2 to 3 years. Table 11.15 dosage guide for patients belonging to Group CR09. Patient population with detectable tumor Group CD. For cancer patients, we have set up the following 3 categories. CT, early stage, the illness had been diagnosed. Treatment was or is going on, but complete remission could not be achieved, or, if so, the patient relapsed. Or conventional treatment is expected to result in the patient's remission, but this can be maintained for a short period, 3 to 6 months only. Life expectancy of the patient considerably surpasses 1 year. CTP progression tumor or tumors are detectable in the patient. Treatment may have been going on for months. Temporary improvement or stagnation may be achieved, but the condition, as a whole, is progressing. No complete healing is expected. Despite the above, the patient is in good physical condition ECOG. 2 and life expectancy surpasses half a year. CTA advanced irrespective of the date of the diagnosis. This category refers to patients who have got under medical control at an advanced stage. The condition has been treated for years, but slowly all possibilities are exhausted. Because of the character of the condition, tumors of the pancreas, disseminated melanoma, glioblastoma. Life expectancy does not exceed or only slightly surpasses half a year. Protocols for patients in Group CD. It can generally be stated that, according to our present knowledge, those belonging to Group CT should consume the preparation for a minimum of 2 to 3 years. Patients in Group CDP for 3 to 4 years. And those in Group CDA, provided they succeed in surviving the critical phase, should consume BD water for up to 4 to 5 years, eventually with shorter breaks. The patient does not succeed in getting into remission. We do not recommend the suspension of DD water consumption, or only after a 4-5 year ion consumption for 1 to 4 months. When establishing dosage strategy, the pace of D depletion should be planned according to the above periods. Establishing the duration of the treatment depends, in the first place, on when remission can be achieved. The sooner complete remission can be achieved and the longer the patient consumes DD water, the greater the probability of avoiding relapse. With patients where no remission was achieved, the application of DD water slows down tumor growth and may result in partial regression, and may increase the efficacy of conventional treatment and survival chances. When applying DD water, it should be kept in mind that improvement or healing may be traced by 2 main factors. If the D concentration in the patient's body continuously decreases, or B, if a D concentration lower than natural is continuously maintained in the body, with the population belonging to Group CD, where, at the beginning of DD water treatment, the tumor is always detectable. Treatment, in an ideal case, consists of 2 phases. Achieving complete remission. B. Maintaining remission. Remission can be achieved by decreasing the D concentration of the body. The decrease of D concentration can be performed according to 3 main strategies of dosage: gradual CTG protocol, fast CDF protocol, slow CDS protocol. If any of the above protocols have been carried out and the patient arrives at consuming water with the lowest D content, the following may be experienced. The patient has reached remission during the cure. B. The protocol is over, but the patient did not reach remission. If the patient has reached remission, it is, of course, not indifferent whether this happened at the beginning of the treatment or towards the end of it. In the first case, the patient has been consuming DD water while being in remission, whereas in the second case this situation has existed for some months only. It can generally be stated that the patient should consume BD water for a minimum of 8 to 10 months even after reaching complete remission. We consider it to be of utmost importance to enhance the range of experiences, as the shortness of time and the low number of cases does not allow us to state exactly after how many months of tumor-free period can a patient be considered as healed or healthy. When dealing with the main rules of application, we mentioned that with some tumor types, an 810 months tumor-free period does not necessarily mean complete healing. The patient continues the consumption of DD water beyond the recommended 8 to 10 months, further improves his chances of healing. The doctor believes that, because of the long-lasting remission, the selective stress maintained by DD water on supposed tumor cells can be decreased. The patient can be considered to belong to Group CR instead of Group CD. Transition to stopping or interrupting the cure is recommended according to Protocol CRN. The protocol ends. Treatment should be carried on according to the summary of the main rules, but following the CRI or CRII protocol. B. If the patient had finished the protocol but could not reach remission, it is advisable to continue the protocol by consuming water of the lowest D content. Based on achievements so far, we may state that with the majority of patients belonging to Group CD, remission occurs within 1 to 1.5 years. In some cases, even within some months. The preparation can be applied successfully with the majority of patients belonging to Group CTP. It is not easy to define results that can be achieved routinely, but in this group, following DD water consumption, regression may occur even if, despite conventional treatment, the condition had earlier been progressing. Depending on the size and type of the tumor, the patient may slowly become tumor-free. It is an important aspect that in case the illness should progress again after years, the patient may return to cytostatic drugs to which the tumor had earlier been resistant. With patients belonging to Group CDA, remission can also be reached. Success may be achieved with various types of leukemia, even in an advanced state, but D depletion has proved to be effective with several other tumor types, for example that of the breast as well. Results are difficult to achieve in the case of solid tumors of a great mass, for example those filling the lesser pelvis, especially if they are of a colorectal origin. Based on our present knowledge, in the majority of cases, with patients belonging to Group CT8, the realistic aim is to improve the quality of life of the patient by causing regression and to inhibit tumor growth for up to several years. The patient is over the first several months of DD water consumption. In some cases, unexpected improvement may occur even after years. In these cases, we suppose that the tumor gets exhausted in a medium of low D content. It is a general experience that the patient should have at least 3 months of life prospects for the positive effect of DD water to assert itself in the long run. Protocol CD. As to the dosage of DD water for patients in Group CT, we recommend 3 different schemes, and one for the termination of the treatment. We consider it important to stress that our recommendations serve as a basis for beginning the treatment. Elaboration of exact protocols, in the light of a great number of parameters, is a task to be solved in the future. Protocol CTGD concentration is constantly decreasing in the patient's body. This protocol is recommended in the case of patients belonging to Group CT. If no relapse occurred from the beginning of DD water consumption, after a minimum of 8 to 10 months symptom-free period, a short, maximum 2 months long break may be held. After this, the treatment should continue with Protocol CRI or the administration 25 parts per million water maintained for a further half year. Table H16 dosage guide primarily for patients belonging to Group CT. Protocol CTSD concentration slowly decreases in the patient's body. This protocol is recommended primarily for patients belonging to Group CTP. If the total mass of the tumor is considerable, primary tumor of 2 to 3 cm in diameter, numerous distant metastases, etc., treatments may start with 75 parts per million DD water. Deviation from the above dosage scheme, inasmuch as it means consumption for a longer time or the decrease of deconcentration, further increases the probability of healing or maintaining remission. Table 11.17 dosage guide primarily for patients belonging to Group CTP. Protocol CTFD concentration rapidly decreasing in the patient's body. This dosage strategy is recommended for patients with whom the tumor is aggressive. The prognosis is poor, and life expectancy is about half a year CTA. Such are melanoma, tumors of the pancreas, acute forms of leukemia or sarcomatoid tumors, or if several relapses had occurred beside conventional treatment. If the protocol has ended, it is advisable to maintain low D concentration by administering 25 parts per million DD water. Table 11.18 Dosage Guide primarily for patients belonging 10 group CTA. Protocol CRN. The gradual termination of the treatment. If the patient is symptom-free, by slowly increasing D concentration, having reached the normal level, a break of 1 to 3 months is recommended. Table 11.19 Dosage Guide before the suspension of DD water administration. Protocol H. When establishing dosage, we suppose an average body mass of 5s70 kg. The daily dose of 0.50. 7 liters is considered to cover half of the average daily water intake. We note that from 90 parts per million water, mix in a 50-50 ratio, we can get 100.7 sppm water. The cure can also be continued so that a daily 1 to 1.7 liters of DD water is consumed in the first and last 2 to 3 weeks of the cure, in the form of a double solution of 90 parts per million water. Table N20 Dosage Guide for healthy people and cancer patients in remission for 2 to 3 years. Deviations from the above protocol: the type and location of the tumor, the body mass of the patient, and numerous other parameters may influence the establishment of dosage, as detailed in Chapter III. We only mention some of these. 1. In the case of certain tumor types, DD water may get in direct contact with the tumor. With these tumor types, those of the oral cavity, esophagus, larynx, stomach, etc., treatment may begin with a water of a higher 100 to 112.6 ppm D content. 2. Volume stated in the protocol may, naturally, be decreased if, for example, children 5 to 40 kilograms or emaciated adults consume DD water, and should be increased if an adult of 90 to 100 kilograms or more is being treated. 3. With patients of a greater body mass or belonging to group CTA, treatment may or should begin with water of a lower 75.0, 62.5 ppm D content.